Welcome to Snackable Health with Gibson and Kohli, and we're talking about President Biden and COVID. Pyle, he made the announcement yesterday that he has tested positive, looks to be doing pretty well. What is your understanding?
Yeah, Mike, this was in some ways not all that surprising because we are seeing so many infections. Our president is certainly traveling. But the things that first come up for me are, of course, his age. At 79 years old, being the oldest sitting president in the United States history, we do worry that he's in the highest risk group for progression to severe illness. Now, the good news there is that he is vaccinated and double boosted, which reduces his risk substantially. He's also got Paxlovid, which he started relatively early in the course of his treatment, which we know can reduce his risk as well. And then we don't know exactly which variant he has, but given that BA.5 is the dominant variant right now in the country, we suspect that may be what he has, and that also does not seem to be causing more severe illness.
Now, he's on some other medicine called apixaban. They're turning down or stopping the dose of that for about 10 days. Talk to us a little bit about drug interactions with Paxlovid.
Yeah, so Paxlovid is a great medication, but it does interact with a long list of medicines. So if you're someone who does end up getting COVID and may start Paxlovid, make sure you check with your doctor or pharmacist if there's an interaction. So in this particular case, the president is on two medicines that interact with Paxlovid. One is called rosuvastatin, which is a cholesterol medicine. Now, interrupting that for a short period of time shouldn't really have any significant consequence on his health. But the second one, as you said, Mike, is apixaban or Eliquis, which is a blood thinner used for atrial fibrillation, which the president has. Now, a few days off of a blood thinner, which we sometimes do when people are going for procedures or surgeries, it's not the end of the world, but there is a tiny amount of incremental risk that comes from each day of being off a blood thinner or being on a reduced dose of a blood thinner in terms of risk of stroke, which is what the biggest fear is when somebody has atrial fibrillation.
Is it just Crestor or statins in general? Because a lot of people out there are on statins.
There's a number of statins that interact, and the way that they interact is because they change kind of what's going on in your liver, something that breaks down drugs. It's called cytochrome P450. So they change the expression of that, and then that can change how much of the other drug, Paxlovid, you're being exposed to, or vice versa. So if you are starting this medicine, Paxlovid, which is indicated for people in a high risk group for progression, whether that's because of age or underlying medical problems, be sure to mention to your doctor or pharmacist the other medicines you're taking.
Great. I know we all wish the president well, hoping for a speedy recovery. Thanks for joining us today, Pyle, and thanks to all of you for joining us here at Snackable Health.